Hello, everyone. Welcome. My name is Georgia Drews. I'm the Senior Associate Director of Admissions at Newman University in Wichita, Kansas. Tonight, we are happy that you could join us for our virtual health science Q&A session. It's not every day that you can go to a virtual info session at a school and you have all your program directors on here and they're here to answer your questions. So we have some questions that were submitted in advance on your RSVP. We also have some that we're able to answer in the chat for you. So the chat is open now. If you think of some things that you really want to answer, they could be really broad questions. They could be very specific to you. We'll try to get through as many as we can. This session lasts until 6:45, so we're going to jump right into it. Each of our program directors is going to introduce themselves. If you'd like to screenshot any of the information based on the program that interests you most, go for it, and then they'll talk a little bit about their program. We're going to chat about the Kansas Promise Act scholarship, and then we'll go straight into Q&A. So this is me. If you have any questions after today's event, you're welcome to email or text me, call me. I'll be the one managing all of our questions today. First up, you're going to get to hear from Timothy Cho. He's the director of our Respiratory Care program at Newman University.
Hello, everyone. Yes, my name is Tim Cho. I'm the program director for Respiratory Care, and I'd like to start off with what is a respiratory therapist? We are highly specialized clinicians that focus on the cardiopulmonary system, and we work with physicians and other members of the healthcare team to treat patients with acute and chronic lung disease. One of the best things about respiratory care is its diversity. We have a huge diversity of patients that we treat, including newborns in the neonatal ICU, all the way up to the oldest of our population. We work in very critical settings such as emergency rooms and ICUs, working with mechanical ventilators and life support machines, but we also work in doctors' offices and in clinic sites in a little bit slower pace and less acuity situations. Some of our RTs work in rehab facilities leading exercise sessions, while others are flying on helicopters transporting critically ill patients from hospital to hospital. So we do a lot of different treatments, including fairly routine nebulizer or aerosol treatments, but we also work with life support machines or mechanical ventilators to assist those patients who can't breathe on their own. Our application period opens in February, and our program is only 3 semesters long, so you'll start August 2025, for example, and graduate December 2026. One of the best things about our program, and I think all of the Newman programs, are our awesome relationship with clinical sites. They provide our students with an incredible clinical experience that really helps them become exceptional clinicians. Many of our students have multiple job offers before they even graduate, so you're looking at a pretty good, easy time securing a job post-graduation. Our applications close April 1st, and the minimum required GPA in all of our prerequisites is at least a C. So, thank you.
Next up, you are hearing from Ashton Clarkson, the director of our nursing program.
Sorry about that. I was muted. I'm Ashton Clarkson. I'm the program director for the nursing department undergraduate here at Newman University. I'm also an alumni of the Newman program as well, so everything is very familiar for me. So a little bit about our program. We offer a bachelor's degree in nursing, so you'll graduate with a 4-year degree. We also are it's a 2-year program, so you can transfer in credits. You can start here at Newman and do all 4 years at Newman as well. We offer a variety of clinical experiences. We start clinical in the first semester. We do some lab stuff initially, and then we move on to the clinical area. And so you get to talk with patients, meet with patients your very first semester of nursing school. And then we also hit all of the clinical specialties as well, from mental health, peds, OB, community ICU, and then a lot of just kind of medical surgical nursing as well. We do admit students on fall and spring, so twice a year. We offer 35 spots per semester. Our application cycles open February 1st, September 1st. We are still currently accepting applications for the spring 2025 semester. It is a minimum required GPA of 2.85. You do have to have a C in all of your courses. So obviously there will be some courses that you will need to get higher than a C in order to meet that 2.85 GPA. After graduation, you can do really all kinds of stuff. A lot of things that Tim mentioned as well. You can work in a clinic as a nurse. You can work in a community hospital setting as well, a smaller entity if that is more your pace. We send students to EDs, labor and delivery, ICU. We just kind of take care of kind of the whole realm of patients. You can also do be a school nurse if you want to work at a school and maybe have a little more of a flexible schedule as far as having summers off and things like that. But overall, I think we have a great program and we just love our students.
Thanks, Ashton. Next up, we have Jeff Vaughn. He's the director of our Radiologic Technology program.
Hi, everyone. Like Georgia said, my name is Jeff Vaughn. I'm the director of the radiology program. And for radiology, it's I think it's a really good opening for everyone to, when I say that, I mean opening for going to different areas, because for us, we're all over the hospital. I mean, we could be working in the emergency room, then you could be working in the operating room, and then you could be just be doing regular diagnostic images. So, and you can do all that in one day. So in our program, we start clinicals the very first semester, and I think that's a good thing because you're putting what you're learning into practice at the same time. And so we send you out. We have about 11 currently. We have 11 clinical sites. And so just like the other ones, they talked about, the different areas that you can work in, but we actually send you to all these different areas as well, just so you can get the patient population is different, but also you get to see what kind of facility you want to work in when you graduate. You go to clinics, you go to hospitals, just like they've talked about. We also do, we've had people get into working in doctor's offices, if you like that Monday through Friday. So we get a lot of, a lot of these places, they call us, pretty much every week, letting us know that there's jobs available. For the radiology program, for the last 5 years, we've had 100% employment after. So it's really, from a lot of places, they tell me I just can't graduate them fast enough. And so, because there's always places to work. All these immediate care places they all have diagnostic technologists there. And so our program, again, is an associate's degree. We only start in the fall, and it's a 2-year program to include the summer in between. We can get about 30, we accept 30 students each year, and our application process will open the 15th of January, and it currently closes on March 1st. Now it's going to be open until we can fill all of our slots. So the minimum GPA is a 2.75. Again, you got to make a C in each area or in each class. But that's, you got to do a little bit more sometimes to get that area, because we are delivering radiation to people. So we really want to make sure you understand and know what you're doing. All right. Thank you.
Absolutely. Next up, we have Brooke Ward, the director of our Diagnostic Medical Sonography program.
There we go. Okay. Yes. So my name's Brooke Ward. I'm the director of the ultrasound program here at Newman. And we have a bachelor's program. Our students run through in 5 semesters. It is set up to go through 3 different modalities. So our students are learning about general ultrasound, vascular ultrasound, and OBGYN. We are in the process of adding echocardiography, and that is something to look forward to in the upcoming years. We do have a similar process to radiology as far as our applications. They become available at the beginning of spring semester, so right after Christmas break. They will be available, although if you're interested in seeing what our application is like, the last year's application is still available for people to kind of peruse through and see what they might be needed of them at that time. Most of that stays the same, just dates change, a couple of variables, but once that application becomes available, it is due at the beginning of March. It does say March 1st, but obviously if that lands on a weekend, it would be the first business day of March. So those applications are kind of a hard deadline for us because we have quite a lengthy application process as far as we have interviews and testing, and each of those take about a week's time. So we try to get all of our students through the month of March and make sure that we have our class ready to go by the end of that time frame, that month of March. So then students can begin in the fall. They would do 5 semesters. The first year is on campus, going through those 3 different modalities that I talked about earlier. They'll be doing part 1 and part 2 in the fall and spring, along with associated labs. So we are a hybrid program where all of our content is online, but they are doing in-person labs. And they're doing those in the same day with the same instructor. So as they're getting that content information, they can still talk to their instructors in lab and talk about that topic, but have the ease of the week to get the content completed for themselves. We do have 12 students or 12 spots available. We did do 14 this year, so that could be a little variable depending on clinical sites. And that is, kind of the drawback on that is that we do have to have clinical locations to be able to accept students. So it's just really variable on that, can go up and down based off of that. But minimum GPA is a 3.0 with all courses a C or higher, like everyone else. You can't have C's in everything to get that 3.0, but we're not masters of everything. So we understand that there could be some lower grades in there. But after that, the students will earn a bachelor's degree, and before that, you'll go through the second year doing your clinical time. It's a full-time externship. So students are in the clinics and hospitals doing that clinical time, and then you'll earn your bachelor's degree. So we have a pretty good program. It's very competitive, but I'm really proud of it. I'm also alumni, went through the X-ray program and the ultrasound program here, so I'm very proud of our school and our students.
Thanks, Brooke. We have, really briefly before we go into Q&A, a unique scholarship opportunity offered through the state of Kansas from the Kansas Board of Regents, specifically for students interested in radiologic technology and respiratory care. Jeff, do you want to touch on this just a little bit?
Yeah, I'll be happy to talk about it. So the Kansas Promise Scholarship is it's only for associate degree programs, and there's only 2 programs at Newman, and that's the respiratory care program and the radiography program. So it's kind of, as far as eligibility, it's kind of you can kind of see on there, you have to graduate from high school in the last year or be 21 years or older. So if you're 19, roughly 19 or 20, you probably don't qualify. And you can be a dependent military service member, and again, it has to be one of those 2 programs. Now, one of the thing is you have to sign an agreement. You have to apply for it, and we try to get you so you're available to get it every semester. And it's up to a certain dollar amount, and it is one of those that's the last in scholarship, which means that all your scholarships are added in, and then this is be the last one to go on top of it. So it does make you sign an agreement saying that you'll work in the state of Kansas for 2 years after graduating. So hopefully and what's interesting about it, it says it doesn't tell you what you have to work in, but you have to, but it, would make sense to if you're going to go to school, to work in the area that you went to school for. So you can enroll full, or mainly it's going to be full-time. There are some stipulations on the part-time part of it, but and you have to have your program, whether radiology or respiratory care, done within a 30-month time frame. So it's like I said, if you can get it every semester, it's pretty good to be able to put that on top of everything else.
Thanks, Jeff. We're going to launch into Q&A. I'm going to leave this up here in case you didn't get it earlier, but if you are interested in a particular program, these are the pictures, names, emails, and phone numbers for all of our program directors. So take it if you need it. We do have our first question is for nursing. What are some of the clinical locations that you guys use for nursing, either in Wichita or surrounding areas?
So clinical sites that we utilize for nursing, we send our first semester students to St. Teresa, Ascension, St. Teresa, and Wesley Woodlawn. Kind of a little smaller hospitals, just kind of get your feet wet and get kind of that introductory clinical experience. And we also send students to a community clinical site, which is Kingman Healthcare, which they have a small hospital out there. Their CNO graduated from Newman as well. And so they're providing really great kind of critical access and some clinical sites or clinic sites as well. Second semester, the majority of your clinical is going to be at Ascension St. Joe for mental health, and then Ascension St. Francis for your medical surgical rotation. We also are sending students out to Kingman for some clinic sites in different departments. We go to Guadalupe Clinic. We go to the Transitional Care Clinic, KU Peds Clinic. We do Wesley Peds, and then we do ICU at St. Francis, and then leadership clinical is kind of a little bit of everywhere. It's just with leaders in healthcare. So some of those are at Ascension, some of those are at Wesley, some of those are at Kingman, and then we're working on some other sites for that as well.
Thank you. Jeff, this one's for you. We have a student who's interested in knowing more about when the actual rad tech classes and labs happen. Are they daytime? Are they evening? What does that look like for your program?
Well, for labs, you're going to have lab for the first 3 semesters, and then, but it's only on Mondays for 2 hours. So you're broken up into 3 different sections for your lab, and we do have, when I say lab, we do have a digital X-ray machine in-house at our facility, and so that will, you'll have to go in and practice with it and kind of get used to it, used to your equipment. But and that's the first 2 semesters, it's going to be on Mondays. Usually, as far as classes are concerned, the first couple of semesters, all your classes are going to be in the morning, anywhere, usually start around 8 or 8:15, and you're done by 12:30. So you have the afternoons to work or or do whatever you need to do. But and then on Wednesdays and Fridays, you'll have class from 1 to 3 for the first 8 weeks. And then the second 8 weeks of the first semester, you'll end up going to clinical just in place of that on Wednesdays and Fridays. But that's a good segue into the spring semester or the second semester, because you'll be in clinical the same 2 days, except for the entire semester. Now, after that, the summer, you're going to have clinical starting 3 days a week, but it's 10-hour days. And you'll do that for your second fall as well. But then you'll have every Friday off. And then your last semester, again, it's 3-hour. Well, let me go back. In the fall, it's 10-hour days as well. But in your last spring, it goes back to 7.5-hour days, and you'll still have Fridays off. So you'll be getting ready to take that certification exam when you graduate. And so there's, we kind of want to get you ready for that as well. So hope that helps.
Thank you. We have a question in the chat about the Kansas Promise Act scholarship. A student wondering if they're transferring in and are 19 years old at the time of attending the program, would they be not eligible for the scholarship?
Probably not. It depends on if you just graduated. So I know it varies from how old students are when they graduate. but it usually they want, if within 12 months of graduation, you know, when you start. So just and that part of it just depends on when you graduated from high school.
Thank you. Jeff, another one for you. How do I find out what the prereq classes are for the Rad Tech program? Do these need to be completed before applying to the program?
Well, there's on our website, it's called a fact sheet. And I think all of us have something very similar to it. But for as far as the prerequisites for me, there's only 6 of them. But you know, as far as your GPA, that's all I go off of, is just those 6 classes to determine eligibility for the 2.75. But you don't have to have them completed before you apply. I give you till all the way through the summer before classes start to make sure that everything is completed. And so it gives, I know students are going to be taking them during the spring semester when they apply. But if you only like one class or something, you know, during the summer, because I know it varies from when classes are offered. And so we kind of give you that luxury of being able to, as long as everything's complete by the time classes start in the fall.
Thank you. For students, this is a little bit for everybody, so you can chime in as you feel. If we have students on the call that are exploring, not really sure, just know they want to be in some type of a healthcare field, how competitive are each of your programs? I know some have more spots than others, some do more intakes than others, but like, how many applications are you getting for the spots that you have available? How competitive is it?
Well, I can start since I'm already off of mute, but you know, the last 2 years we've had 53 applicants, but again for each year, and so we accept 30 spots. Now, that varies. The first year we had 18 on a wait list, and by the time classes started, I exhausted my entire wait list and started with 29 instead of 30. Now, starting this year, it's a little different. I had the same number of applicants, but I had 13 on the wait list, and I only took 6 off of the wait list. So it kind of varies from year to year.
Yeah, so nursing, it kind of goes in cycles as well. Our fall class, we tend to have more applicants than our spring class. But we are currently not filling our class, so we are accepting applicants who are qualified and meet all of the requirements. So that's kind of where nursing is right now. If we do need to use a wait list, we will. But we haven't been filling classes the last couple of semesters, so yeah, that's where nursing stands.
Great. Brooke, how competitive is your program?
Okay, so we're pretty competitive. We have over 30 applicants every year, and so I would say we're running less than, we don't have 50%, I mean, under that, so being accepted. So 14 over the 35, so we've got quite a few people that are not making into the program. So the higher GPA helps, you know, making sure you do really well on your interview, you know, making yourself more marketable for the application is the best route to go on that. We also encourage our students to apply to multiple options. Radiology is a good one because it's if you've taken everything you need for sonography, you've got everything you need for radiology. So I always, you know, tell students if they have an interest in both to go ahead and apply to both.
So we're kind of like in the same boat as nursing. Our class sizes do vary, but lately we have not been filling our class, which is a maximum of 20. However, we do hold the admission criteria pretty strictly, so you still need to meet the minimum requirements of the prereqs and have 6 prereqs completed prior to matriculation into the program.
A few more questions coming in on the chat. Nursing, for you, Ashton. We have a student asking about our bridge program. Talk more about our bridge program and who specifically it is for.
Right. Yeah, our LPN bridge program. So what that is you have to have your LPN license in order to be part of the bridge program. And essentially what that does is having your LPN license will qualifies you for kind of waiving a couple of classes in the first semester. And so that will waive your Foundations of Nursing course, and I'm trying to think off the top of my head. That might actually be the only one, because we do require you to take pharmacology in the first semester just because it has a lot of dosage calculations in it. And then we do require you, it waives your clinical practice course as well. And then you take clinical through the LPN bridge course. So you don't have to do any of the lab that goes with that clinical practice course. But then you need to take health assessment and intro to professional nursing in the first semester. And then you're just on track with the rest of your cohort to move through the program.
Thank you. Jeff and Brooke, we have a question that I feel like we get a lot, but we've got a student that's maybe interested in rad tech and sonography. Would you recommend applying to both programs if they meet the prerequisites? Can they do rad tech and then roll into sonography? Help us with that a little bit.
Yeah, and so we do encourage you, if you meet the prerequisites for both programs, like Brooke said, if you got the ones for sonography, you're going to have the ones um, for radiography. So we do encourage you to apply to both, just for the fact that we want you to not get left out of either one, because you can always go, if you get the rad tech into the rad tech program and complete that, well, you can continue on into sonography after that for your bachelor's degree, as long as all the prerequisites are done. Now, I caution you, there is one course that Brooke requires for sonography, and that's physics. But I do allow you to take, you can take a regular physics class, or you can take my radiation physics class, but it's only offered in the fall. So depends on when you're going to apply. That could be, could affect when that seems to be one of the hiccups as far as the classes. And we don't want to, I offered that just for the fact that there at Newman, if you take a regular physics 1 class, you have to have trigonometry to get into it. And so I think we're trying not to add to the overall curriculum that Brooke has just to do that. So we allow you to do that physics class. Now, and if you go through the rad tech program, you'll get that class as you go through. So just depend, we do encourage you to apply to both programs if you have all the prerequisites.
Brooke, anything to add?
Yeah, I was just gonna say I totally agree with that. That was the path that I took. I went ahead and did radiology first, and then went and did sonography afterwards. And I don't think that you could go wrong with doing that. You make yourself pretty marketable out there. You can work in X-ray, you can work in sonography, you can do both, but you cannot do the programs at the same time. So that is something to keep in mind. Some people think they can, take both classes and do that, and it doesn't work that way. So if you're signing up for 4 years, going through the 2 programs for sure.
All right, guys. I know I probably have the answer to this, so anybody can answer, but does it matter where students take the prereqs for any of the programs? Are there any do's or don'ts? Can they do them at Newman? Can they do them at a community college or another school? What do we prefer, or do we?
Well, I can tell you most within, within Kansas, we pretty much accept from community colleges as well. Pretty much all of them in Kansas, we have an agreement with them that we will, accept those courses. Now, for especially the one that I always caution students about is anatomy and physiology. A lot of those places you have it A&P 1 and A&P 2, and you pretty much have to take them both at the same location. Or a lot of times they have a combined course. And so the combined course, either one, if you do it either way, it will transfer to us. But just be careful about, taking one A&P1 somewhere else and then A&P2 a different location.
Georgia, can I just add to that real fast? Is the only stipulation would be is that you're taking a course from an accredited institution. So that you make sure that that is in place. And if there really is a question, if we would accept it or not, they can reach out to the registrar's office, or they can look online, because we do have a list of courses that will transfer in, so they can look at that. If they don't see it on there, then reach out to the registrar's office.
Yes, thank you. We can always help you with that. It's better to maybe check in advance than to spend time taking a class that then doesn't meet the requirements that you're expecting it to. Does anyone else have any opinions or things to share on that?
I wanted to say, sorry. I was just going to say real quick on the sonography, if you do take your courses at Newman, your prerequisites, you get a 1% bump on your application. So a priority application. So we accept them from anywhere, that they would transfer, of course, if you take your courses. But if you take them through Newman and process through that direction, you do get a little bump. So I just wanted to throw that in there.
And I wanted to mention too that we will accept a transfer of pathophysiology, but it has to come from Butler, and it needs to be the 300 level course, I believe. So has to be pathophysiology. I think they offer an intro to patho, but it has to be the pathophysiology course that we will accept.
Cool, thank you. Brooke, one for you. For sonography, what specifically are you looking for in the interview process, and do you have any tips?
Yeah, so tips would be just to practice, of course. Any kind of interview can be a little nerve-wracking, especially if you've worked really hard to get there. Just practicing your voice, knowing that you can just not be so nervous when you come in and talk about, doing some shadow time, showing that you've had an interest and invested your time in the field, know about our program and how it's set up. I can't tell you how many times, somebody else say they're interested in something, and then I'm like, have you done any research on our program? Nope. So it's a good idea to, know what you're applying for. Do your research and understand what you're getting into. But yeah, look professional. It's a professional program. We're healthcare professionals, so we want to make sure that your voice and your image all match those. So
thank you. Let's see here. Oh, I had some new ones submitted. Tell us. Oh, nursing, Ashton. What kind of grades do they need in their prereq classes to get into the nursing program? You probably talked about this a little bit earlier. Also, the GPA to get into the program, is that every college class they've taken? Is it just the prerequisite classes? Can you talk more about that?
So we just look at the prerequisite classes that are needed to get into the program as far as the GPA. The GPA is a 2.85, and we want you have to have a C in all your courses, and so that means you'd have to get some courses have a little bit better grades. As far as like success in the program, we find that if you're stronger in your sciences, you're more likely to be successful in the program. So if you want to really strive for success, then I would really concentrate on your sciences because they are the foundation for a lot of our programs.
Thank you. Tim, for respiratory care, can you tell us a little bit more about what it looks like the day in the life of a respiratory therapist in the hospital or wherever it is they're working? What kind of things might they be doing?
Sure. So locally in some of the larger hospitals like Ascension Via Christi or Wesley Medical Center, your typical shift it's usually a 12-hour shift. We'll often work 3 days in a week. So, for example, if you work Sunday, Monday, Tuesday, you'll be off Wednesday, Thursday, Friday, Saturday, Sunday, Monday, Tuesday, Wednesday, and then work the Thursday, Friday, Saturday. You could have like 8 days off in between working those 6 different shifts. And so you'll come into work, you'll have report with the previous therapist who took your patients, get all the status changes, and then you'll be off to the various areas that you're assigned to. So one of my personal favorite was the burn unit and the emergency room. And I liked the traumas that came in and all the unknown kind of new exciting things that would roll into the door of the emergency room. And took care of a lot of asthmatics down in the ER, along with trauma patients and things like that. And the other place you might work is in the ICU, taking care of like 4 or 5 different mechanically ventilated patients, managing their the settings and how the breath is being delivered to the patient. That's where sort of the art of respiratory care comes in. You know, you can dial in certain settings, and however the patient may not like it. So you have 2 options here. You can either drug the patient up to sedate them and make them go to sleep, or you can make the ventilator more comfortable to them so that they don't need the drugs to be comfortable on the vent. And that's sort of the art of respiratory care, talking with the physician, especially the new medical residents who don't know how to use the mechanical ventilators at that point because they're still in training. And so we give that advice, suggestions, things like that. And then, you know, usually sometimes the assignments may shift. You'll give report to the next person, or you'll keep those patients for the rest of the night. And that's sort of the continuity of care that you get. You might learn a little bit more about your patient during that time. And even the next day when you come back, you might be able to see them again, see their improvement, interval improvement, things like that. That's sort of the neat thing about respiratory is many of the interventions we do have quick turnaround. And so you get that instant gratification of, hey, you know, we fixed that person, and it's kind of neat to see.
Thank you. We have a question, and I think, Jerry, this might be a good one for you, so everyone doesn't have to chime in, or you all could, but we have a student asking about eligibility for national certification at the completion of any or all of these programs.
So I guess I can start since I was just talking, so you can hear me for a few more seconds. For respiratory care, you basically, for this program, after you graduate, you're able to sit for your credentialing exam. And that credentialing exam will give you a credential that would be usable across the nation. The only thing that you'll have to do at that point is get a license to work in that particular state. So there's only a couple states that don't have a license, like Alaska, but pretty much everyone else requires a state license. And one of the important first steps of getting a state license is to pass your credentialing exam.
Oh, I can.
Take
Oh, I can go. I was just going to say again, for radiology, you can take it right as soon as you graduate. You can take your certification exam, but also another big thing about the radiology program is it opens other doors for you, such as you can do MRI, CAT scan, you can do mammography, you can do interventional radiography, you know, without actually going back to school. So just says you got to have 16 hours of education. But so it does, you do have some more doors that it does open for you, as you know, but the initial thing is to pass that certification exam for diagnostic radiography.
For nursing, after you graduate, you can sit for your licensure exam, which is a national exam. So it can be taken, when you take the test, you can take it anywhere in the United States. But then after you pass, you will be only licensed in the state that you applied for originally. But Kansas is part of the compact. And so your license then for Kansas is essentially good in several other states. I can't think off the top of my head. It's above 30 states who are part of the compact, so you can go and work in any of those states without actually having to apply for a license in that state. But some states are not part of the compact. So if you wanted to move to, let's say Alaska, because that's one that's not part of the compact, you would have to apply for a Alaska license. You don't have to take the exam again. You just have to apply for their state licensure.
I was just going to
Uh,
say that. Oh, go ahead, Brooke.
Sorry, I'll just say ours is a national, boards that we have for each of those modalities. So you would have to take a physics board to start, to pair with any of the other ones. Any of them you would take, or you can't have that credential. So you have to have the physics board, and then you would be eligible to take vascular, OBGYN, and general. So to have those, and there is no state licensure for sonography. So it is just the national board. But if you were to do anything international, you would have to take a different board. So there's that.
I was just going to say for radiology, just like Tim and Ashton said, you're going to have to apply for the state license. So just realize those are separate things. And so while you're in the program, we kind of help you through the process. For radiography, we always have someone from the state come down and go through it because it can get a little complicated. And it changes faster than you think. And so it always helps to have someone that can explain all that to you. So.
Yeah, we do the same thing as Jeff and RadTech. We also embed the whole licensure application process in our curriculum so that someone's guiding you through the process.
Thank you. We have a student in the chat that has never attended college, just really wants to know more about the steps for applying and getting started for the Rad Tech program. Where do they start?
Well, I think the first thing is to apply to whatever school you think you want to go to. But I mean, as far as your prerequisites, just remember those prerequisites. Most of them, if you're here in the state of Kansas, most of them are going to transfer to us. But you got to get your prerequisites in before you can start the program. So, talk to her like Georgia. You can talk to Georgia as a missions counselor, kind of get through that process. But but Brooke mentioned this earlier about shadowing someone. Here in Kansas, especially in the Wichita area, they're going to allow you just call them up there. You can figure out how to go shadow someone because we really want you to know what you're getting into. So when you get into the program, you kind of have an idea of what to expect. Occasionally we'll have someone that comes in, they said, oh, that wasn't what I thought it was. And then they drop out, but then that doesn't happen often, but they took up a slide that someone else could have had. So we ask you, if you can do that, please do so.
And just real quick, the other thing you could do is, I'm sure all of us are willing to meet with you and give you a tour of our labs, show you some of the things that we do, and sort of, I guess, open your eyes to what that profession can offer you, give you sort of a day in the life, some of the tasks that we might do, things like that. So if that seems a little more approachable for you, yeah, don't hesitate to reach out to us and we can set up something like that.
And I was going to say, don't all of our classes that all of our programs have outstanding labs. I mean, Brooke's got ultrasound machines you can practice on. Ashton's got mannequins that talk to you, right? So you can kind of get a real world experience about that. And Tam can put them on a ventilator. So, I mean, there's, you get some real world experience before you actually get to the clinical site.
Thanks, guys. We have time for maybe a couple more final questions. Rad Tech, Jeff, we have a student asking if it's possible to do travel jobs post-graduation.
It is possible to do travel jobs, and what it requires is you have to do 1 year of working somewhere, and get some experience under your belt, and so to speak, and then you can go travel. So that's kind of how that part works. again, if you travel, it does, make pretty good money. And you get to go to a lot of different places, but getting that first year under your belt will be the key.
Thank you. We also have a question for you, Jeff. You've been popular tonight. What is the best approach to securing a shadowing opportunity?
Well, it's usually not too difficult. There's a number of places you can get most of the hospitals here in town. You can call at least their HR and tell them, hey, you want, or even radiography. Hey, well, shadow. Now, what you'll have to do is probably sign some documents because for HIPAA purposes, because you'll see probably patient information. But it's just good to get in and see what you want to get into. So having just a better understanding of what you're going to do. So you can all the main hospitals here we've talked about, St. Joe, St. Francis, Wesley. I know Rock Regional and Derby does some. You can just go in, depending on where you're at down in Winfield. They'll be happy to have you come in the hospital as well. So there's a lot of places that you can. That will allow you to come in and just shadow someone.
Okay, one more just because somebody says. Nursing. Do you guys have acute nursing specifically within the nursing program?
Okay, say that one more time.
The student's asking if we have acute nursing. Not like pretty, but ACUTE, acute nursing.
But acute. Yeah, so most nursing, is acute nursing. We go and see patients in the hospital. Those are all acute cases. We don't really have any long-term care clinical sites right now. It is something that we're looking into possibly implementing into a first semester, but all the clinical sites that we currently go to are all acute care nursing. So all the hospitals, probably maybe not some of the clinics that you go to, but all the majority of hours are going to be acute care.
Okay, and then maybe like one more question. Hold on. Sonography, Brooke, last one. Premise. How often do people get put in clinicals that are not within the Wichita area? And what happens if you can't travel for that clinical site?
Yeah, so we have our clinical locations locally in surrounding cities and surrounding states. So we do this to offer the students a multiple experiences and also to grow the program. So it offers spots, up to give to our students. So we're not saturating our local sites. It depends on the year as to how many we go, but I do like to try to do 50% because it brings back some new information for our students to learn about in their locations. And it's been a fun experience. Students, when they apply to the program, know that they could be matched into a location that's outside of the Wichita area. And so when they come, I'm sorry, my throat's been bothering me. So when they apply to the program, it is with understanding that that is something that could happen. Our students are placed in a match process where they put their selection of locations that they would like. And then I get video interviews of our current students and send those out to our locations. And each of those people make a selection on the students they think personality-wise would best fit their group. And then we do the match process from there. Those are set the way that they are because otherwise it would be unfair to make selections outside of that process that way. So if a student feels that that's not a right fit for them, then it may not be a right fit overall. But it is a cool experience. So I think if you open your mind and consider the fact that it could lead to a pretty awesome job. We've had students that have gone and lived where they went to work and really enjoy it and come back and say, I'm so thankful that this took me out of my comfort zone a little bit because it offered me something that I wouldn't normally have done. So.
Thank you. I promise that is very Very last question. We do need to move on, but a little bit of info before you guys leave. Thank you for joining us and for all your awesome questions tonight. I wouldn't be doing my admissions duty if I didn't tell you more about how you could take some next steps toward any of these programs. I know some of you are transfers, some of you are first-year students coming out of high school, some of you may have already applied and been admitted. We are currently taking applications online for spring, summer, and fall of 2025. If you're thinking 2026 or beyond, those will open later, usually next summer, but you can apply for any of the 2025 terms right now. If you are coming out of high school, even if you've earned some college credit, you would be considered a first-time student. On the screen here, you can see some of the scholarships that we award automatically upon acceptance for first-year students. Our application is online. It's completely free. You don't have to do any recommendations, essays, or personal statements, and we are test optional. So the only thing you need to be admitted to Newman is at very least a 2.25 GPA. And typically we do take your weighted if you have different GPAs on your transcript. If you have a 2.25, you're automatically admitted. You have at least $10,000 per year, and all the amounts you see here are per year amounts. So if you qualify for 14,000, you get 14,000 every year for up to 5 years, and the only thing you have to do to keep it is maintain a 2.0 GPA. Now, 2.25 to be admitted, 2.0 to maintain. You'll notice these programs all have different GPAs. So this is just for being admitted to the university, not necessarily to the programs. If you're a student who went to some college after high school, whether it was a semester, whether it was 10 years, I don't know, you would be considered a transfer student for application and scholarship purposes. And you can see here the way that we award our transfer scholarships solely based off of your cumulative transfer GPA, and our ranges are 11 to 15,000. These are good every year for 3 years. Only have to maintain a 2.0 GPA. A lot of you had questions that were very specific to your situation, your plans. And we tried to answer as many as we could, but if you feel like you'd like to make a plan with one of these directors or another faculty in those programs, I highly recommend scheduling a one-on-one campus visit. You can customize those to your liking. Typically, we do try to get you on a campus tour and to meet with admissions, but you can also opt to meet with faculty in your program of study, try lunch in the dining hall, go to mass, sit in on a class. So look at that. I put the links for the application as well as scheduling a visit in the chat. We also have a Health and Medical Professions Day coming up on Saturday, November 16th. If you would like to do some hands-on activities, see the labs, meet the directors, and just get a good, robust look at campus and if it could be a good fit for you. You don't necessarily have to be like transferring immediately or be a current high school senior. If you're interested, come see us and we'll show you what we have to offer. So that's the end of our night. We are recording this and putting it on YouTube. So if you know someone who might benefit from this, we are having our next one on November 19th. You can RSVP for it at newmanu.edu/visit and go to our events tab. Thanks to all of our program directors and our dean of the School of Healthcare Professions for joining us. We'll see you next time.